Welcome to My Long Island TV. From Manhasset to Montauk, we have traveled our communities to bring you the following events. I'm your host, Waldo Cabrera. My Long Island TV starts now. Prostate cancer is the most common diagnosed solid tumor in men. Nearly 250,000 men will be diagnosed with this disease, which has no symptoms.
Once you have symptomatic prostate cancer, the disease has already progressed outside the prostate and is no longer curable. So the key to treating prostate cancer is early detection. It remains the second leading cause of cancer death. So despite all the advances in diagnosis and treatment, nearly 30,000 men are going to die this year from prostate cancer, which is about one man every 30 minutes.
Unlike other diseases, there's no diet or activity that will help you avoid prostate cancer.
There's a strong genetic predisposition to the disease. You can try to improve your prostate health with a good diet and exercise and drinking plenty of water, but ultimately speaking, if you're destined to get prostate cancer, you're going to get it. So if you have a family history of prostate cancer, particularly in a first-degree male relative, like a father, brother, a paternal uncle, then your risk of prostate cancer is higher and you should be screened earlier. And most significantly, if you're of African American descent, you should start getting screened earlier. More than twice as many blacks as whites die of prostate cancer. And in fact, the highest incidence of prostate cancer is in African American of Caribbean descent.
The right time to get your first prostate exam is determined by your family history.
Every man should get a baseline evaluation sometime between the ages of 40 and 50. If you're in a high-risk population like we talked about, Waldo, like an African American man or a patient with a family history of prostate cancer or someone with environmental toxin exposure, then perhaps you should be between 40 and 45.
According to Dr. Kapoor, a man's best weapon in the fight against prostate cancer is a woman.
It's part of the psyche for women to do routine preventative maintenance and routine health care. Men just don't think that way. And that's really unfortunate because as a consequence, we sometimes don't get men into the system until it's too late. So if there's any woman watching today, make sure that that you go ahead and badger the men in your life that you love, whether it's your father or your husband or your brother or your son, that if they haven't had their prostate evaluation done, it's in their very much best interest to go ahead and do so.
The evaluation of prostate cancer involves two components: the PSA blood test and the digital rectal exam, which makes many men cringe.
The simple fact of the matter is it takes just a few seconds to do. It's minimally uncomfortable, and the benefits thereof is potentially it can save your life. And so it really is something that men need to, I hate to be abrupt, but we sort of have to get over ourselves.
The two main therapies for prostate cancer are radiation therapy and surgery. The survival rates for these methods are essentially identical. Many times, treatment is selected based on personal lifestyle.
You know, most people with other forms of cancer don't have the opportunity to choose a treatment based on their lifestyle. It's okay, you know, you have a cancer, this is the treatment, take it or leave it.
Another concern for men is erectile dysfunction.
There is a subset of people that will have difficulty with erections after treatment. Most of those men are people that already have a history of erectile dysfunction. So prostate cancer therapy may exacerbate a problem that already exists. And of course, there will be some men that don't have a problem that will develop it later. That should not be the determining factor because, again, not to be a little off color, but we tend to talk very candidly with our patients. And I tell men, you can have an erection like blue steel, but it doesn't do you any good if you're 6 feet in the ground.
The death rate from prostate cancer rose from the 1970s through the 1990s. Then, with the advent of broad-based early screening such as the PSA test, the death rates plunged. African American men who are most affected by prostate cancer showed a steeper decline in prostate cancer deaths than their white male counterparts. That means that the outreach programs are working. Unfortunately, due to a recent government recommendation, the death rate rose for the first time since the early 90s.
With the USPSTF recommending that no man be screened, a one-size-fits-all recommendation that doesn't take into consideration the increased risks to African American men, we're now seeing all the progress that we made in 25 years starting to become undone. So I really want to encourage men to avail themselves of early detection efforts so that they don't subject themselves to unnecessary health risk.